Hi friends, this is Dr. Vihan Sanyal, and today I'm going to talk to you about psychosomatic illness or psychosomatic disorder. Before I start, let me just explain what a psychosomatic disorder is. A psychosomatic disorder is a disorder which does not have an organic cause. For example, a person with a stomach ache goes to see a doctor. The doctor runs all kinds of tests and finds that there's no illness, a physical illness, which is causing the stomach cramps. And then they get referred to a psychologist, a psychotherapist like myself, and we do an evaluation and find out if there's an emotional cause for the stomach cramp. So yes, friends, emotional issues can manifest as physical problems, especially if there have been dormant emotional issues which they're suppressed, people haven't dealt with them. They can easily manifest over a period of time into physical ailments or physical problems. Okay. Some of the physical problems which people have come and seen me about have been things like headaches, migraine headaches, tension headaches, cluster headaches, stomach cramps, palpitations, nausea, IBS, which is an irritable bowel syndrome, okay, where people have an alternate between constipation and loose motion. Then there are the skin ailments like eczema, psoriasis, and hives. Okay, then you've got high blood pressure, ulcers. Okay, so inorganic causes can be quite serious if they're not dealt with, and they can then lead into real physical problems. So I always encourage people to seek therapy early on, as early as possible, and we've got wonderful tools that we can use to help people overcome such issues in their lives and lead a comfortable life. I can discuss some of my previous cases with you. I remember a young man who was recently married with a child. He used to visit the hospital almost every second day. In the middle of the night, he would wake up in a sweat and he would feel like he's having a heart attack, and he would rush to the hospital. The doctors there would run all kinds of tests on him and find out there's no physical reason for his condition, and they would send him back after doing emergency treatment on him. He later was referred through to me, and I explained to him that what he was experiencing is nothing more than panic attacks, which can seem as real as a heart attack because they mimic the symptoms. So after several sessions of therapy, he was absolutely fine, and those visits to hospital stopped, and he has been living a happy life now. So that's one case. There's another one of a young girl. She was a college student, and she used to get strong stomach cramps just before exams, and this went on for years. Every time she would come near close to the examination dates, she would have these stomach cramps. She was staying in a hostel. The people used to send her to a hospital. She used to get hospitalized for a day or two. They used to run tests, find nothing wrong with her, send her back home. She was then referred through to me. I did some psychotherapy, therapeutic interventions, and after a couple of sessions with her, the stomach cramps completely disappeared. And now she has completed her studies, and she's living a nice, healthy life. That's another case which came to my mind. So then there's been cases with migraine headaches. The people have been suffering for years, and we've done psychotherapy work with them and have relieved their condition. So friends, with psychotherapy, psychotherapy takes a little bit of time, and in the interim, if you look at the conventional medication that's available, they're usually painkillers and so forth, which can help reduce some of the symptoms. Okay, but then there are wonderful medications which are available through Ayurveda, which I feel that, you know, while we're using psychotherapy, the Ayurvedic treatment can do wonders. They can also help strengthen the system from within, and build the person's immunity. And while we do psychotherapy work, it can overall, you know, really help the person to come out of some of these issues, because people tend to suffer from these issues for years, without knowing that, you know, treatment is available and alternate therapies are available to them. They continue to suffer. So I'm actually reaching out to all of you through this video, and to your loved ones. You know, please don't suffer in silence. Please seek help, because there is help available, and you can really come out of all these issues and enjoy life and lead a healthy, prosperous life. So you can take help of NDK Neurogram, and through them you can contact me, and I'll be more than happy to assist wherever I can through psychotherapeutic interventions. Thank you for your time today.